Can I also ask you about BOAS surgery or airway surgery? So this is a common airway corrective procedure that we perform for pugs and Frenchies and bulldogs and other brachycephalic dogs. Can you tell us a bit more about why this surgery is so important for them to have, and when you would recommend that a dog have this corrective surgery if they do belong to one of these breeds?
Sure. I'd add Cavalier-King Charles to that list as well. I think they really benefit from the surgery just as much as the more obvious squishy-faced breeds like Frenchies and Bulldogs and Pugs, Boston Terriers as well. Basically, their head is this big, but it's squashed up. So all the airway is all squished, so the air doesn't flow through properly. We can't pull their nose out, but we can open up the airways as we need to on a case-by-case basis. And this might mean opening up the nostrils so you can breathe through. Otherwise, they're trying to breathe through something that feels like they're pinched their nose. And the soft palate at the back of the throat is all squashed up in a smaller space than it should be, so the air can't get through it either for that reason. Basically, the soft palate should be able to, the air should go down the air pipe, and the soft palate blocks it. And so when they breathe in, it sucks it in, and it doesn't work. So you trim that so air can get in, and that helps as well. There's a couple of other things we do. But these dogs really benefit from them. Frenchies, we see a lot of it. We do a lot of surgery on Frenchies, just because there's so many of them, and most of them do need it. You asked when, as in what age. Generally, they're going to need it between 8 to 12 months of age. That's a good time to do it before they start getting sick from not being able to breathe, and then they have greater issues under the anaesthetic and things like that. In the past, we used to do these surgeries only on dogs that were super ill, super struggling to breathe, and dying. And so there was a greater risk doing those anaesthetics because the patients were so critically unwell. It is much better to do them younger. The surgery is easier. You could consider it routine at that age. And obviously they benefit from the surgery for the rest of their life rather than just trying to save their life when they're 10 years old.
I've certainly seen some of those older dogs that are really struggling. They've got so many secondary changes that the surgery has much more limited benefit than if you got in and did it earlier before all those second changes come in.
Yeah, for sure. And they've spent 10 years not enjoying their life.
This is true. Yeah. Poor things. We can improve their quality of life.
For sure. Absolutely. Very satisfying thing to do.
Yeah.